The teleneurology stroke response is 24/7, 365 coverage that we provide to the hospitals, where we're on screen within 15 minutes as part of that stat stroke team, helping to make the care decisions. We're there to co-manage the patients alongside the hospitalist team, so we focus a lot on integrating with the medical staff on site, the relationship building. We have nearly 800,000 stroke cases per year. Every one of those 800,000 or so stroke patients per year really ought to get seen as timely as possible. When a stat stroke alert gets called, we would get called as part of that, and then our teleneurologists would come on screen to evaluate the patient within 15 minutes of a consult being placed. They're there to evaluate the patient with a telepresenter on the other side of the screen. That's usually the patient's nurse. The telepresenter will, if family or EMS are around, they'll pull them up in front of the screen so that we can get collateral information. The telepresenter will help us obtain our neuro exam findings or our NIH stroke scale, and then we'll, go through the patient's electronic medical record, look through their history. If it is truly a stat stroke alert, then we're the ones who make that thrombolytics decision. We'll stay on screen, throughout the whole process of dosing it, making sure the bolus is given in a good time. And then after that patient evaluation is completed, then we go into the native EMR system and write up our notes. So our notes look like anybody else's notes in the EMR system. And then we get on the phone with the requesting clinician, who's usually the ED doc, and do a doc-to-doc to discuss that acute care plan. It's not just an on-demand initial consultative service. We have a whole continuum of care that follows after it. Our tele programs are comprehensive, meaning we see the full spectrum of neurology care.